I think the big challenge when patients get diagnosed with cancer is it's a little bit of a puzzle that they need to piece together with these different appointments spread out sometimes over the course of weeks. So what we try to do is put all of those pieces in place in one setting so that there's a much clearer picture when the clinic visit is over, what the treatment plan is, when we start, and patients feel confident and comfortable, kind of ready to get started.
When someone is diagnosed with cancer, we often hear that patients want a few important things. They want information, they want to know the plan, have confidence in that plan, and they want to get it going as quickly as possible. Our multidisciplinary clinics are built to accomplish those things for patients. It's an optimal way to provide care, and simply put, it's what's best for the patients. We offer several multidisciplinary clinics at Multidisciplinary Cancer Center for breast, lung, thyroid, and prostate cancer.
So what's unique about our clinic is that we do this all in a clinic with everyone present. Lots of places will do like a multidisciplinary tumor board where people behind closed doors will talk about patients, review their imaging, and come up with treatment plans. But that plan is usually presented to the patient by one person. We're unique because the entire team is there. The patient gets to meet everyone and gets to ask specific questions related to that facet of their care with the person that would be providing that to them.
I'm Jared Cast. I'm the Executive Director of Multidisciplinary Cancer Center. Multidisciplinary Care Clinic is a collaboration between physicians coming to one location for the patient. The experience is wrapped around the patient. The patient doesn't have to move. It's an investment in our patients and the program to provide the best high quality care we can. We do this for multiple reasons. Partially for the collaboration between the physicians. It's really important for physicians to be on the same page and be heading in the same direction for complex cancer care that we give here. We have patients that travel around the state and also have a shorter time that we want for them to be able to start their therapy. And if we can get all the specialists in the room at the same time, collaborating with that patient and working with that patient the same day, it's able to speed up some of that care that we give. From my standpoint, I've been to multiple cancer centers around the country. This is really the best possible way to manage very complex cancer patients that we care for.
Mercy recently added a survivorship clinic. The clinic addresses issues that patients may face as they move forward from treatment.
Survivorship is kind of a buzzword in cancer, and a lot of places offer survivorship, but they do that in a referral-based model where they'll make appointments for patients on different days, potentially over the course of weeks, encompassing a lot of the things that we offer in one visit. So the nice part about our survivorship clinic is everyone is there to meet with the patient and to work with them on different facets of their life. After treatment, we continue to follow the patients in a multidisciplinary way with a variety of different resources, things even like mental health, physical therapy, cancer nutrition, to really help them get back to a thriving life after treatment that many people struggle with for years after treatment. With prostate cancer, one of the biggest functional impacts to Guy's life is sexual function. And that's sometimes glossed over in appointments where there's such a focus on the cancer and getting rid of the cancer and patients being cancer-free. We have certified sexual health therapists that work through our survivorship clinic to really dive in not only with the patient, but the patient's partner, who we encourage to come to those visits as well, and to really talk through some of these things that can be embarrassing, that can be things that patients aren't very forthcoming.
I'm very proud of the technology and the innovations that we have implemented into the cancer care, but truly it's the way that we care for the patients. The patient-centered care centered around multidisciplinary care clinics is exceptional.
As you've heard, Mercy's Multidisciplinary Cancer Center offers multidisciplinary clinics for breast, prostate, thyroid, and lung cancers. We're developing additional ones for the most common cancers we see as well. Offering a survivorship clinic like we've begun is just another component to making sure our patients have quality care plans, access to providers, and the confidence they need during a trying time in their lives. As always, thank you for trusting Mercy with your care.